So what about protecting your family, and can things be business as usual at home? To give us a look at what we should be thinking about when it comes to COVID right now and how things in hospitals are going right now, Dr. Ken Joseph, as always. Thank you for the time, sir.
Thank you for having me.
Yeah, let's talk about hospitals, because I'll read you a quote that we heard this morning from a doctor. He was saying that this is the worst scenario that there could have been in this process. What has been so tough for hospitals right now when it comes to Omicron?
So I think in general, it's just basically been the sheer volume of patients that are coming to the hospital combined with the staffing shortages that we're having. We're definitely seeing well beyond our peak numbers of hospitalizations that we had over a year ago.
Wow. Is it more manageable now, since we talk about symptoms now being a little more mild, do you think, or no?
So, there are parts of that question where we can definitely, it's better in the sense that I think we've learned a lot more. We know exactly how to kind of treat it. But on the other hand, when you just have this sheer volume and those shortages, it creates a complete different challenge.
The challenge for, I guess, at home is not really knowing how to handle things. I think that sometimes we feel like there's this mixed message. It's milder symptoms, so we're all going to get it, so we'll be okay. But then we see the numbers of these hospitalizations and the deaths as well. So help me balance the scale a little bit.
Yeah, definitely. So I think in a lot of ways, Omicron is kind of exactly what we were all waiting for to a certain extent, in the sense that we want it to be milder. We knew that it was going to kind of go through the population like this. I think to confound that with the hospitalizations, I think that is still being driven by Delta. And so that's really where the issue is. And it still remains, a pandemic of the unvaccinated.
When it comes to vaccinations, do you feel right now, at least, is it helping the situation a little bit in the numbers that you're seeing, at least at your hospital so far?
1,000%. A majority of the patients who've come in have been people who are either remain unvaccinated or received their 2 vaccine shots greater than 6 months ago, and now are, have other comorbidities. But I definitely believe that the hospitalizations are actually not driven by Omicron, but rather Delta.
Let's dispel some myths here, because just because you have the shot, even the booster, do not go ahead and disregard masking and clean hands and that kind of stuff. We should still be holding on to these protocols.
Definitely. You're definitely at risk for catching it, even with the vaccination, even with the booster, but your symptoms will be significantly milder. So, at this time, you still have to maintain those protocols.
And also, like restaurants in New York, we're seeing, in Baltimore as well, they're asking for these vaccination cards. I mean, this is instrumental in keeping not just the staff, but the patrons, I guess, healthy as well.
It is. It is something that if you want to go out and do normal activities again, the best way through this, that what we've been saying for the last year now, has been vaccinations. And I think that has been the hardest thing as healthcare workers to kind of hit home, that we continue to see people who are scared of the vaccine, and then they come in and they're completely sick and they're ravaged by this disease. And I think this time around, especially with the holidays, the thing that we are seeing is that it's ravaging families. So we have multiple members of the same family in the hospital, and that's what's really kind of soured us a little bit.
From a medical standpoint, when you see some of the video now of people going out to get tests and you see these long lines, what goes through your mind as you see all this happening now?
I genuinely just feel kind of sad for everybody. And to a certain extent, I would have to say that it is a public health failure that we've had over the last year, that getting tested is taking this long for people. We should not, we were talking about this a year ago, that test will also help us get through this. And a year later, there's not been a single change. And that is very disheartening.
Yeah, that really gets me. I mean, when you see these pictures, we could almost replace the pictures from a year ago, and it looks identical to me.
Exactly. And honestly, there's just no excuse for it. I don't know what we've done from a public health standpoint, but when we talk about, all these things building back a better America, one of that has to be a better public health system.
So I'm guessing we're just living with this at this point. I mean, is this something that throughout the years, and we've talked about this before, I mean, variants are going to come and go, correct?
Variants are going to come and go, and we are going to live with this. Like I said before, I think Omicron is kind of more of a signal of hope, in the sense that if the variants can continue to become milder and milder, then it will become like your annual flu season. Right now, it's not like that, but hopefully we can get there by the winter of 2022.
Last thing, what can people do to help folks in hospitals, the workers? I mean, they're putting in the hours, and it's been tough go for you guys. What do we need to do at home so that your numbers stay down?
Again, get vaccinated if you haven't. If you're more than 6 months away, please get your boosters, and then avoid large crowds. And then when you are out in public spaces, please wear a mask.
All right, that's Dr. Kendall Sheth. Thank you as always. We appreciate it.
Anytime. Thank you for having me.
Mm-hmm.